using ENACT's new, easier-to-use web client to run COVID-related queries. Here are a few tips that will help you save time, minimize error, and find the results you're looking for. Tip 1. There's a shortcut to find the most common COVID search concepts, including diagnostic lab tests, diagnosis codes, and vaccine data. Click the ENACT COVID-19 folder to see these time-saving search concepts. Tip 2. False COVID test results and repeat testing means that the number of COVID tests at any given site will likely exceed the number of patients tested. Tip 3. How often a site updates its COVID data will affect your results. Check to see when sites have last updated their stats. A site that last updated in March of 2020 will show no COVID results. An update in May of 2020 will only show first wave results. Tip 4. Patient cohorts since March of 2020 may appear healthier than usual. That's not necessarily true because patients have been avoiding hospitals since the onset of the pandemic. Patients appear to be healthier than usual, even in cases where their medical records are up to date. Just because a patient is not diagnosed with comorbidities doesn't mean that they don't exist. Tip 5. COVID codes change over time. Searches using older codes will miss out on newer patients and vice versa. Be sure your searches include the right codes so that you can find the right patients. Tip 6. Positive COVID test reveals very little about when a patient became infected. Researchers may find it more useful to search for an admit date within a week of a positive COVID test. Tip 7. Sites vary in how death is coded. In some instances, a site may not show a clear date of death. A date of death can sometimes be approximated by looking for when a patient has no further data. Tip 8. Indirect indicators of disease severity can be revealing. An organized list of direct and indirect markers of COVID severity can be found under ENACT COVID-19 course of illness. ENACT has rapidly developed COVID-specific query tools and continues to work on refining these tools. Investing in infrastructure like ENACT enables fast mobilization of national research resources to meet future global health challenges. Contact your local CTSA institution to learn more about the ENACT Network or visit enactnetwork.us.